Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. What is the DSM-5 and what does it diagnose? The DSM-5, otherwise known as the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, is a book published by the American Psychiatric Association, APA, to help mental health providers diagnose mental disorders. /r/n/r/n The DSM-5 is an invaluable tool given that mental disorders cannot be diagnosed in the same way as physical illnesses. The DSM-5 categorizes 298 mental disorders based on an established set of criteria, such as behavioral or emotional patterns and the duration of these patterns. /r/n/r/n This helps psychiatrists, psychologists, and other health providers accurately diagnose mental illness so that the appropriate treatment can be sought and dispensed. /r/n/r/n In 2022, a revised version called the DSM-5TR was published. The DSM is occasionally updated as researchers gain a better understanding of mental conditions, often recharacterizing them to more accurately reflect their nature. /r/n/r/nPeopleImages, Getty Images /r/n/r/n The Diagnostic and Statistical Manual of Mental Disorders was first published in 1952 and has been revised and published in 4 subsequent editions and several interim versions. The latest version, the DSM-5TR, was published in March 2022. /r/n/r/n The 130-page DSM-1 published in 1952 listed 109 mental disorders under 3 broad classifications: psychotic, neurotic, or behavioral. As with future editions, the DSM-1 was criticized for characterizing certain states as pathologies, illnesses. This included homosexuality, which the DSM-1 classified as a sociopathic personality disturbance. /r/n/r/n The DSM-2 published in 1968 was only slightly longer than the DSM-1, 134 pages, but contained a total of 182 mental disorders. /r/n/r/n As with the DSM-1, the symptoms of these disorders were not always clearly defined. Rather, symptoms were often regarded as a reflection of an underlying conflict or maladaptive reaction to life problems, largely remnants of Freudian psychoanalysis of the 1920s and 1930s. /r/n/r/n As such, the DSM-2 largely characterized mental illness as a consequence of external factors rather than a disorder of the mind. /r/n/r/n The 494-page DSM-3 published in 1980 was regarded as a radical revision of the earlier editions, adopting a consistent set of diagnostic criteria to classify 265 mental disorders. /r/n/r/n Among the changes in the DSM-3, egodystonic homosexuality replaced the term sexual orientation disturbance, while gender identity disorder in childrenGIDC was first introduced to describe the concept of gender dysphoria. /r/n/r/n The DSM-4 published in 1994 listed 410 disorders in 886 pages. In it, a mental disorder was for the first time defined as a clinically significant behavioral or psychological syndrome or pattern that is associated with present distress or disability or with a significantly increased risk of suffering death, pain, disability, or an important loss of freedom. /r/n/r/n The definition was significant in that it qualified a mental disorder as one that causes distress and/or problems functioning in social, work, or family life, a definition that largely persists today. /r/n/r/n Despite these changes, homosexuality was still described as a sexual disorder not otherwise specified, while mental retardation was still used to describe people with intellectual disabilities. /r/n/r/n The DSM-5 published in 2013 was not a major revision of the DSM-4. Rather, it focused largely on deleting numerous subtypes that caused overlaps in diagnoses and sowed confusion among clinicians. From the 410 conditions listed in the DSM-4, the DSM-5 offered 298. /r/n/r/n among the changes, /r/n/r/n rather than classifying subtypes. The DSM-5 more often uses specifiers to clarify the course, severity, or special features of a disorder. For instance, specifiers for a condition like autism may be as simple as mild, moderate, or severe. Others may be more complex. /r/n/r/n among the other changes in the DSM-5, homosexuality was finally declassified as a mental illness, gender dysphoria replaced gender identity disorder, intellectual disability replaced mental retardation, and manic depression was reclassified as bipolar I and bipolar II disorder. /r/n/r/n The DSM-5 serves as the principal authority for psychiatric diagnoses in the United States. While it is published by a U.S. health authority, it is used worldwide and published in 18 different languages. /r/n/r/n The DSM-5 contains descriptions, symptoms, and other criteria to help clinicians make reliable diagnoses of mental disorders. However, it does not include information or guidelines for the treatment of any disorder. /r/n/r/n Instead, psychiatrists, psychologists, and other health providers will turn to clinical practice guidelines from the APA, which does offer guidance on the appropriate treatment. /r/n/r/n Other countries use different clinical practice guidelines, which can vary based on the licensing of drugs, availability of drugs, or authorized treatments, such as ketamine therapy. /r/n/r/n In the United States, the diagnoses in the DSM-5 match up with ICD-10 codes used by clinicians for insurance approval and payment. Based on the ICD-10 code of a DSM-5 diagnosis, a treatment may be approved or denied. /r/n/r/n The DSM-5 is written in a common language and divided into three sections. /r/n/r/n The DSM-5 breaks down mental disorders into 19 broad categories. It is possible and, in fact, common for a person to be diagnosed with multiple disorders in one or more categories, known as a dual diagnosis or multiple diagnosis. /r/n/r/n While the DSM-5 focuses on mental disorders, conditions involving the mind and brain are often inseparable. For this reason, the DSM-5 also covers conditions like dementia that may be purely psychiatric, purely neurological, or both. /r/n/r/n Among the DSM-5 TR categories are /r/n/r/n For each condition, the DSM-5 outlines a list of criteria a person must meet in order to be diagnosed with that disorder. Some criteria are behavioral, like repetitive behaviors, while others may be emotional, like distress. There will also be a specific period during which a person must experience symptoms in order to be diagnosed. /r/n/r/n The DSM-5 also offers a category called unspecified disorder, which allows a clinician to forego specification. This is used when a patient's symptoms fall within a group of disorders but do not meet the DSM-5 criteria exactly. Unspecified disorder has an ICD-10 code, meaning that insurance approval and coverage for treatment can still be sought. /r/n/r/n The DSM-5 operates on a multiaxial model in which 5 axes: psychiatric, intellectual, medical, environmental/psychological, and level of functioning are considered to make a more informed and individualized diagnosis. /r/n/r/n The Diagnostic and Statistical Manual of Mental Disorders, 5th edition, is the premier source of diagnostic information on mental health conditions. The 298 disorders are broken down into 19 categories, with each assigned a list of criteria a person must meet to be diagnosed. /r/n/r/n. The DSM-5 does not offer treatment guidance but provides clinicians with the means to access treatments based on approved national treatment guidelines and the ICD-10 code assigned to the DSM-5 diagnosis. /r/n/r/n, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.